What really causes heart disease in human beings? This is a very important question. And I know that if you've been to your doctor lately, you think that it's caused by high cholesterol, high LDL, high ApoB, and inactivity. That's what you think. But there's a new study out in JAMA Cardiology that is just blowing all of this pseudo information, these lies that your doctor's telling you unknowingly, but still misleading nonetheless. So this study, they took data from the Women's Health Study, which was a 21-year-long observational study of 28,000 women. And what they found is going to blow you away. And I love this because this is really the first time I've found research that shows you the hazard ratio or the relative risk of one risk factor versus another risk factor. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience. And in this video, I'm going to tell you exactly what causes heart disease. And once you know, then you can use other videos on my channel to reverse your risk of heart disease. Because all of these things that are listed on this list, I have videos about how to reverse them, because I've known for some time what actually causes heart disease. And I'm glad that the Journal of the American Medical Association is finally catching on. So what did they find in this study? So they found that the biggest determinant, the most dangerous thing you can have, is type 2 diabetes. And it had a hazard ratio of 10.7. That's a very high hazard ratio. The next is metabolic syndrome, and it had a hazard ratio of 6.0. So not as dangerous as type 2, but still quite dangerous. Number 3 was high blood pressure. It had a hazard ratio of 4.5. So less dangerous than diabetes, but still not safe to have high blood pressure if you want to avoid heart disease. Next was obesity with a hazard ratio of 4.3. So being obese, not just overweight, but obese, the clinical definition, increases your risk of heart disease. Not as much as diabetes, but it still ranks up there. The next one is smoking. It had a hazard ratio of 3.9. And you probably thought that smoking was much more dangerous than having type 2 diabetes. It may be for overall health, but for heart disease, type 2 diabetes is much more dangerous. Next is high triglycerides, which had a hazard ratio of 2.1. Next is, oh, wait a minute, here's LDL cholesterol, way down here on the bottom of the list. It had a hazard ratio of 1.6, okay? So having high LDL might be a little dangerous, but having type 2 diabetes is 10 times more dangerous. Having metabolic syndrome is 6 times more dangerous than having elevated LDL. Having high blood pressure is 4 times more dangerous than having high LDL. Being obese is 4 times more dangerous than having high LDL. So I think this study really brings it home that you need to worry about the things at the top of this list. And you need to eat a diet that will reverse the things at the top of this list. And so if you want to reverse type 2 diabetes, I have several videos on this channel of how to do that. If you want to reverse metabolic syndrome, I have several videos on this channel that will help you understand how to do that. If you want to lower your high blood pressure, I have videos about that on this channel. If you want to reverse your obesity, I have videos about that. Now, if you want to reverse your risk from smoking, then you just got to quit the damn smoking, okay? There's no way around that. You got to break that addiction. If you want to reverse high triglycerides, I have several videos on this channel about how to do that. But if you want to focus on your LDL cholesterol, I'm going to tell you, you need to ignore that and focus on the most dangerous things at the top of this list. Now, what 3 things that you hear talked about very often didn't even make the list? The first one is total cholesterol. So the next time you go to your doctor or healthcare provider's office and they want to start talking about your elevated total cholesterol, you can just stop them right there, because I put a link to this research study in the show notes, but down below, you can print out the abstract of this article and you can take a copy to your doctor. And you can say, hey doc, will you shut up about the total cholesterol? Let's focus on my type 2 diabetes and my metabolic syndrome and my high blood pressure. You know what? Never mind, because I've already watched Dr. Berry's videos and I reversed those myself. So why am I here again? If your doctor wants to talk about you're too sedentary, you're inactive, that also didn't make the list, okay? If your doctor is very woke and wants to talk about your ApoB, your apolipoprotein B, again, didn't even make this list, okay? So you need to focus 100% of your energy on reversing your type 2 diabetes, on reversing your metabolic syndrome. And if you don't know what metabolic syndrome is, I've got videos that will explain it, what it is, and also how to reverse it. If you have high blood pressure, you need to get that down. And watch my videos about high blood pressure. If you still have to take a low dose of one single blood pressure pill to help get your blood pressure normal, then you need to do that. If you're obese, you got to fix that. Being obese is not healthy. I don't care what they said on the cover of Vogue or Cosmo, whichever one that was. Being obese is unhealthy. It is dangerous. It is 4 times more dangerous than having high LDL cholesterol. Quit the smoking, guys. You got to quit that. If you have high triglycerides, watch my videos and reverse that. When you reverse any of these things on this list, you erase that risk from your personal risk every time you roll the dice of life. Because every day we get out of bed, we roll the dice. But if you've reversed type 2 diabetes, metabolic syndrome, high blood pressure, obesity, high triglycerides, if you've reversed all those, then your dice are loaded in your favor. If you haven't already done so, click the subscribe button and the little bell button right beside it. That way you'll get a notification when I post my 2 to 3 new videos on this channel every week. And if you would like to help me take this kind of message to the world and help educate ignorant doctors all over the world about what really increases your risk of heart disease, then please consider becoming a patron on patreon.com. There's a link down in the show notes. It's a quick sign up. Then you can throw a buck or two my way and join my health army and help me improve the health of the entire world. This is Dr. Berry. I'll see you next time.